have your ceremony this evening, so we have to make some preparation. So we'll try to
Finished already?
yes, because possible presentation. When we do the next presentation, I'm going to come back to some more details on the corpus luteum. Okay, because then we find once we
I didn't even
put the
try
corpus
reading
luteum
it.
better. So when we do the next presentation,
I
we
read
will
long
look at
is this
the
on a
corpus
television
luteum.
this?
Okay. No, what are we looking at the
I
slide
never
out
watched
here?
this.
Okay, what is this slide out now? So what are we looking at right here? Alright.
Mansumo.
Anyone want to venture a guess what we're looking at the slide out here?
Tajumo sama.
Okay. So
It's a
Jason,
blana.
we're relaxing. Alright. So
There's a
this is
blana.
an interesting slide. Okay. So what
It's
is
not
this
a bladder.
slide out here?
Probably. I don't know. Probably it's blana. Because the muscle.
Here we are. Yeah, Dave, everything okay, Dave?
And epithelium.
So there we're looking at a slide now of what?
Or
What is this
uterus. I
slide
don't
of right
know.
here?
Could be bladder. Could be uterus. He has a muscle. I can't tell.
I don't know.
I see muscle. No, but uterus is smooth muscle.
I see an
The uterus
epithelium
is
here,
smooth muscle.
right? Isn't that so? So, and this epithelium, I don't know what you say that
No,
epithelium,
bladder
but I
smooth
want
muscle
you to
too.
see you.
That's
Oh, don't see, no, don't jump in there so fast. Don't so fast. No. Take your time, take your time. Alright. So, what type of epithelium are we looking at here? Alright, so what is this? Collapsing. Alright, so look at the epithelium here. So I think this is also right behind me. We're looking at this epithelium. And I'm going across here. Okay. Alright, I'm going across
Could
here.
just say,
If I come way down here, I come to something quite interesting. I come way down here.
oh,
So
what's the
there's no
vagina?
epithelium coming down.
What's it
Really,
It's supposed to be ovaries and female reproductive system.
interesting.
What's the vagina?
Oh, here. I'm gonna look for the hand that
So now it's vagina, bladder.
Yes. Yeah, well, I haven't started yet. You're not doing anything. So let's go.
It's a good vagina.
So I see this structure right here. So can you hear me now? At the front, can you hear? Very good. So I immediately encounter this boy right here. So I encounter this boy. This boy serves a very important role in the overall structure that we're looking at here. So, there is a man by, is Steve Hamilton here or he hasn't come? Steve Hamilton, alright. This will get me program. Alright. So, who is it? Let's ask Marlon, what is this structure that we're looking at here? What is this structure here? So what is this structure that we're looking here at here? Okay, so we're just relaxing. Okay? We're just relaxing. And let me try to give you a little hint. Let's go on to the height over here.
Yes.
Right there. Alright. Right there. Let's look there. Look here.
If it's in
Look here. Very good. Yeah, we're looking
there.
there. Then we're shooting across right over here. And then we're coming down into this corner there where we encounter a very interesting fellow. You're what? Lost. So, just having a little fun. So, this structure plays a very important role in the overall thing that we're looking at today. Alright? So, anybody wants to guess what is this structure that we're looking at? No, there's a man here, yes, I've seen, from the Ready Institute. All right. So, Ready, what are we looking at here now? That's a Pacinian corpuscle. Okay? Pacinian corpuscle, when you do some cooking, very good. When you slice an onion, and you look at that onion looks like a what? A Pacinian corpuscle. And the function of the Pacinian corpuscle is for what? Pressure. Alright? To register what? Pressure. So somebody played it very nicely. Very good. Alright? So what? Pressure. Very good. Very good. To register what? Pressure. So, what are we looking at here? So where do we need to have some real pressure receptors? Alright? So that pressure. So when that urinary bladder is filled, you start to feel the what? Pressure. Stretch that's occurring, isn't that so? Alright? So this is our slide of the urinary bladder. Okay? So if we went into the exam, this would be a slide of what? The urinary bladder. You see the epithelium, that epithelium is what? Transitional. Then it has are we seeing much of the lumen? No. We're seeing only a small fragment of the lumen. Alright? And there is the underlying lamina propria, and all of this muscle is referred to as what? Intrusum. Okay, this is the intrusum. Okay? And outside of this, this is taken from the superior surface of the urinary bladder, because you can see what? A conspicuous curtain. Alright? And that's the visceral apparatus. Apparatus that's covering the walls. It's covering the walls. That's the apparatus curtain that covers over it. Which you could see forms a visceral because the viscous. Yeah? So it's a visceral. Yeah, but it's primarily from the apparatus curtain. So the choice of the word there is very interesting. Okay? So it's peritoneum. That peritoneum is what type of cell? Simple squamous, alright? So there you see some simple squamous cells right here. So what are we looking at here? We're looking at the slide of the urinary bladder. Okay? So I just brought that up. I brought a slide of the eyelid to show you, but I'm not impressed with it. I'm not going to show you. Alright? So let's get into it. So today we're going into the land of the female reproductive system. Alright? So female reproductive system, very interesting. Alright? And the first slide we pick up here is a slide of what? What are we looking at? And this is a slide of the uterus. Alright? And what's immediately conspicuous about the uterus versus the wall of the urinary bladder is the vasculation. Right? So the myometrium. So there is a perimetrium, isn't that so? The outermost coat is referred to as a perimetrium. Alright? So that outer coat here is a perimetrium. And in this part of the uterus here, there should be more loose connective tissue associated with this. But in this, all we're seeing is what just represented primarily by a peritoneal layer. Okay? Alright, so it should be thicker than this, having a lot of blood vessels, etc. But in this specific slide, it's very reduced. But we're going to look at other slides. Okay? So I'm starting here today at the uterus. So the uterus has an outer wall here. That outer wall is known as the, you could also say that a bit of this is perimetrium. But it is really more what? Muscular. So in fact what you're really looking more is what more? Myometrium. Okay? This is more, very much more myometrium. Okay? And we observe that the what? That it's highly vascularized. Okay? And we know that the uterine artery is going to ascend up along the lateral border and give branches that go over the anterior and posterior aspect, and then branches that penetrate into the myometrium, and these are what are called the coiled arteries. Okay? So they literally spiral through the myometrium, they twist through the myometrium. Okay? Now the reason, obviously, why the wall of the uterus is so rich in blood vessels is that This is to support pregnancy when the pregnancy will occur. Now, laying on that, so there will be a perimetrium right here. Then we get a myometrium, and deep to this we get the endometrium. And in the endometrium, the glands are going to penetrate into the lamina propria. Okay? So we're looking here now at the endometrium of the uterus. Okay? That's the endometrium of the uterus. And you will also know that the endometrium is going to have various phases. Okay? So when we start building back up, we're in the proliferative phase. Okay? Then we move into a secretory phase, and then we move into the menstrual phase. Okay? And we note now that the endometrium has what is referred to as a functional layer. So the bulk of this is referred to as a functional layer, and the very lowermost part, just where the bases of the glands are located, is referred to as the basal layer. Okay? In menstruation, it is the functional layer that is lost. The functional layer is further subdivided into a what? A stratum, compactum, and a stratum spongiosum. Okay? So there's a compact layer directly below. There's what's described as a compact layer, stratum compactum, and the stratum spongiosum. And that stratum compactum and spongiosum will form now the functional layer. So this is going to be lined by what? It's going to be lined by what type of epithelium? What type of epithelium is going to be lining and it's columnar. Okay? So columnar epithelium is the choice epithelium of the female reproductive system. In the fallopian tubes, it's going to be ciliated columnar. Okay? But this is basic columnar epithelium. So there's a columnar epithelium which will rest on a basement membrane. Okay? And then directly below this epithelium will be what is referred to as a compact layer of the lamina propria, and there we can see the glands. Okay? Now, the glands in this stage here, when we look at these glands here, the glands are not wide open. Okay? So we can say that this is, I would say, just at a junction between proliferative going into a secretory type phase. Okay? The glands are not wide open. Glands are not wide open. For example, if you examine a baby like this, when you're sort of more close like that, then this would be say this would be more the proliferative phase. Okay? Now in time, so obviously you're going to see it cycling through. Alright, so now it's a gradual, it's a biological system. You're not just going to go proliferative, everything proliferative, then what? Secretory. There's going to be a gradual transition going from what? Proliferative to secretory. So this seems to be more towards the proliferative phase, and because the glands are not wide open. Okay? So that's one uterus for you there. But I brought up a number of them because you have to try to look at the various phases right here. Okay? In fact, this one is in fact just the scene of the same slide. So let's put that out there. Let's put the next one here. Alright, so there once again we're just seeing a lot of what? Smooth muscle. Alright? And we are noticing what about the smooth muscle? That it's highly vascularized once again. So there are a lot of coiled arteries. There are a lot of coiled arteries in here in cross section. Okay? Let's look outside and see if there's any much perimetrium. It's okay, but the perimetrium is a bit cut off. Okay, so there's not much perimetrium. When this slide was taken, it's going right into the myometrium. Okay? And above the myometrium here now we're seeing the endometrium. Okay? Now what you can see basically is that a lot of these, there's a lot of autolysis occurring here. Things just look as if they're breaking down. Alright? And if we trace it up, we see what? There is no epithelial covering. There's no epithelial lining So this is definitely in the what? In the menstrual phase. Okay? So they're little, those arteries are called heliceae, little spiral arteries. So they're little spiral arteries. So when the endometrium now starts to be sloughed off, alright, in the menstrual phase, what we find is that a lot of the little blood vessels don't just start to spew blood before they can go into spasm, okay? Before they can actually seal off and go into spasm. Not only is the epithelium lining, but in this case here, very interestingly, the menstruation this is just in a very, very early phase, maybe day 1 or so of the menstrual phase. Okay, because you can see that still a vast amount of the what? The endometrium is left back. Because we'll see some slides that all you're seeing left down is just right back down here, the very basal layer. So regeneration of the endometrial glands is going to occur from the base. So just the basal layer. But in this case, a lot of the functional layer is still there. In fact, in this case, it seems as if just the stratum compactum has left, but the stratum spongiosum is still intact. But we would classify this as a menstrual phase uterus. Interestingly to see the glands are all breaking down. Okay, so the glands are all breaking down here. All right, when you come and we look, so they're all disintegrating. You can see that and see blood. So all of this is blood. Okay, so all of that you're looking at here are red blood cells. So those little spiral arteries now are just spewing blood into the cavity of the womb. Okay, so the glands are breaking down here. You see a lot of fluid. See a lot of fluid. You can see that the whole endometrium is being eroded away. Okay, as I said, that's the very basal layer, and it's just at the very basal layer. This is what's going to be left back. So I may have in here some slides just showing you the basal layer left back. But once again, you see the myometrium, and you see the muscles running in all different directions. And as I said, interestingly, are the arteries, or these coiled arteries, highly coiled vessels. So lots of arteries located in there. See blood, these are all just blood vessels from the uterine artery. And the ovarian artery is also going to give a branch. There's also going to anastomose with it. Okay? Alright, so that's another phase of it. This looks to be the same phase here. I don't know, see, let's see. I just looking at it, this seems also to be a uterus in. Yeah, this is another menstrual phase uterus. So you can see this one here, so this is maybe taken just a little later on, alright? And far more of the functional layer is gone, okay? The other one, there was the stratum spongiosum was much larger, okay? So this shows even a later stage of okay, let's move on now and look at this one here. Okay. Alright, wow. So, this slide is wrongly labeled. No. This is not uterus at all. Not at all. Okay. Alright, so that is not what's the label at all, sorry.
I wish I could
Okay, beautiful. Very, very good. Alright. So I like this. Okay. I like this here. Alright, so this is in a secretory phase, right? This is in a secretory phase here, and you can actually see the what? This secretory material in the endometrial glands, okay? So we're looking here at the secretory phase of the uterus right here. The epithelium there is quite intact, okay? And notice that the glands are wide open, and actually the secretory material is there. There is the myometrium, and This one has a bit more of the perimetrium here. So that loose connective tissue, so the perimetrium is far more conspicuous on this. Okay? But there we want to get a picture now of the glands open. Okay? So that's a good example of uterus in the secretory phase. Alright. Alright. So, alright. Very good. Very good. Very good. Alright, so what phase are we looking at here? That's a proliferative phase. Okay? So this uterus here is in its proliferative phase. Beautiful. Fantastic. Alright? So this uterus here is in the proliferative phase. Okay? And you can see that the glands there are few. You can see that. They're starting to re-establish themselves. So the endometrium is re-establishing itself here. And there are not many glands at all. Okay? The epithelium is very conspicuous here. Like that. So there's columnar cells right there. And this is in a definite proliferative phase. Okay? So the endometrium here, what's seen in terms of the population of the endometrial glands, they're very sparse. Look at that. So the endometrium here just has just a few glands. So this is just menstrual phase, and it's just now starting. The glands are just starting to re-establish themselves in the endometrium. Okay? So that's good because we saw all phases of the uterus. Now go to uterine tube. Go to uterine tube here. The uterine tube is one of the easiest slides to identify. It's very easy, just like thyroid. It's a very easy and straightforward slide to identify. Why? So that's why. Because there's no other slide that looks like this. We say the lumen is what? Labyrinthine. The lumen of the uterine tube or fallopian tubule is labyrinthine. What does that mean? Tina, what does that labyrinthine? Looks like a what? It looks like a what? A cave, right? Like in a cave, you know? A cave or maze, yeah, like in a labyrinth. Okay, so when you go in the cave looks like you're in a labyrinth. Okay? Alright, in the labyrinth, you know, in the cave you have all these sort of stalactites. You know, you ever been in a cave? No. Alright, so if you go in a cave, you see all these stalactites and stalagmites. So I spent about 10 years caving until I was forced to stop caving. I used to love, I spent a lot of my weekends going way down underground. And places I go to I would never go through today. So way down all 100 feet or however underground and going through some tiny little holes that I could barely squeeze through. Madness.
Well, you get to front now?
So I used to enjoy going caving a lot. Until I went in the bush and ended up with some sort of thing that you thought was there, anything like lions, disease. So some plant, I came upon some very strange plant that gave me, man, I thought I had to write my will. It was terrible. So my days of caving came to an end. Alright? So, used to go down in the caves, very interesting in Jamaica, and you see a lot of the bones of the Arawak people. So the cave, the China or the Arawak people used to bury, they used to carry like, I don't know what they used to lighting maybe, but they would go way down under, so the Arawaks, they would bury the bodies. Then when the bones were ready, they would take, disinter the bones and hide them in all these caves. Way, far into the cave. And you wonder how they managed to see, because we're going with all sort of lighting. The only because they reached down there. Alright, so, but
Anything he talks about adventure.
the real thing that brought my caving to an end is that I went in a cave one day where it was very gradual, then night was catching up. You have to come out the cave the other way. And I was climbing. When I looked behind, I said, my God, what the hell is that? Like a sheer cliff going down. And I'm holding on to like 3 branches.
You really good at what is cute.
Give up the cave, alright? But we have lots of fun.
Labyrinthine.
So the cave here looks what? Labyrinthine. Okay, so the what? The epithelium of the fallopian tube is what? Highly folded. So there's a highly folded epithelium. Alright? Highly folded. Not only folded, but they branch. So they fold and they give branches. Alright? So we can see the branching. Alright? So what's the clinical consequences? Have you got lectures on this part yet? Have you been lectured on this? Yes or no? But I'm going to come back to that slide. When you come back to that slide right there, this slide has something that I want to show you particularly about the fallopian tube. Alright, so this is another fallopian tube. Alright? I'm going to just look at this one for a minute here. Alright? Because this one shows something of interest. Alright? What's it showing of interest?
Cells.
Well, yes, there are peg cells there, yes, there are peg cells. But what is it showing of interest also? It's cilium, alright? So it's what? Ciliated. But remember, not all the cells are cilia. So we're going to get what? Patches of cilium, okay? So we're going to get patches of cilium, okay? So the epithelium, and there are other little cells in there. So little cells, the smaller little cells that they call peg cells. But we've never really asked you to identify peg cells. Okay? So there we can see what? The lining epithelium. So that lining epithelium has cilia in parts. And obviously that cilia is to move the what? The egg along. Okay? That's the primary to move the egg along so we don't end up with an ectopic pregnancy. Alright? But what's the clinical consequences of having a labyrinthine lumen? So what do you think is a big problem in having a labyrinthine type lumen? What's the problem in having a labyrinthine lumen? So you're going to see a lot of it in your practice, whole heap of it. Lots and lots of it. So lots of it. Having a labyrinthine lumen is going to give you many, you're going to need, so you're going to have a lot more patience. Right, you know? A lot more customers, alright? So a lot more people coming in. Alright, so hold on, we're seeing something interesting here. What are we seeing here? Okay, well, this is I picked up the wrong slide. Good. I picked up the wrong slide here. Alright. Okay, that's uterus, yeah. That's the uterus there. That's what ended up in what? And it's a nice uterus, it's in a secretory phase. Alright? So now let's get back to it very quickly. Ms. Lawson, why would this labyrinthine lumen bring many patients to you? No sir, not so much. Not that much. No. I'm talking just as a general practitioner. A lot of ladies going to come to you with this problem. The problem is, doctor, I can't get pregnant. Alright? Why? Because the tubes become easily what? Blocked. Okay? Because of the labyrinthine lumen, many women suffer from what? Blocked tubes. Okay? So in the blocked tubes, eggs cannot meet sperm. Alright? So everything is blocked off. Okay? So especially also when there has been infection, when the infection is there, then that infection rapidly will move up into what? Into the uterine tubes. Alright? So Marlon, lots of your patients coming to see you are going to be coming with problems along these lines. Okay? And then you're going to send them on to the ONG person, and that ONG person is going to do a study for a hysterosalpingogram. So they're going to put some dye up into there and see now if the dye can go through into the what? The peritoneal cavity. So when they can't get that fluid, in the old days what they do is actually blow it out. Or they take like some of the older doctors would take like a blood pressure thing, go and pump it up and try to pump air through the tubes, okay? So, Marlon, you can try your own procedure. Alright? Okay? Alright. So there we see now the slide of the uterus, the uterine tube, or the fallopian tube. So you know there's the fimbria at the end, alright? So all these lot of these little things here now, at the end we're going to see lots of extensions like what? Like these called the fimbria, okay? And remember there's one special long one that sometimes you're going to see on the slide of the ovary. That one is called the fimbria ovarica, okay? So there's a fimbria ovarica, one of these very long. So, but anyway, we can see that this is, at the end, just going to, the similar little fallopian tube is going to send out a lot of these little finger-like processes, and these will be called the fimbria. But within here, these are just called the folds, and remember the folds are going to be branching folds, giving rise to an epithelium. And there are mucous cells here also, the ciliated cells, they're mucous cells, and there are also the peg cells. Some people say that the depleted mucous cells become peg cells. Okay, so that's a theory that no one is really going to question it too much on. Okay, and outside there is a serosa type layer because there is a what? There is the what? The peritoneum on the outside, and then there is attached to it the what? The mesosalpinx. All right. Okay, so let's just take a look at one or two other ones because in the exam you may not get that particular side. In fact, I look back here and some of them are looking quite different. So I want to show you some different. So this one looks just basically the same. All right, that's basically the same. But this one is a bit different. Just looking macroscopically, he looks different. Let's look at this fallopian tube. All right, so there we're seeing another fallopian tube. But you know you're going to have what are the parts of the fallopian tube? No, the segments. There's an ampulla, but there's a what? Infundibulum, that's the funnel part, the ampulla and the what? And the isthmus. Very good. Alright? So there are different parts. So this is another one that we're looking at right here. Okay? So Marlon, if we go into the exam, alright? So this is another slide of the what? Of the fallopian tube. So really there shouldn't be anything to confuse you with fallopian tube. In the older days we used to have also slides of the placenta. And the placenta in some ways looks a bit like the fallopian tube, like what we're looking at here. But they no longer ask placenta in the exam in terms of histology. Okay? So it's another example of the fallopian tube. So let's take a little look at it like that. Nothing else looks like one of the easiest things. Just like thyroid, easiest ever to identify the fallopian tube. Alright, one last one. Okay, just showing you different profiles. Alright. Of the fallopian. And this one is basically looking very much the same. And the Brinstein type. Okay, so we leave that. And then now we move on to real business. And real business is talking a lot about the ovary. Now the ovary, we have to visit quite a few slides on the ovary to really sort of see the whole structure of the ovary because each one is going to show something different. So the ovary has an outer cortical layer. Isn't that so? The ovary has an outer cortical layer. Alright? Ovary has an outer cortical layer and an inner one, medulla. In the outer cortical layer, this is where we're going to find the what? The various follicles at different stages of development. So think about, the women start off with about how many? The little girls start off with how many? Or how many do they start off with? Or how many do you start off with? When you start the journey, how many do you start off with? Alois right on the ball, I hear his voice. Yes, I think Alois is saying 400,000. Right, we start off with 400,000. Okay? So in America and all these developed countries, you're paying something like 10,000 US if you're willing to donate some eggs. Alright, so there's some vast sums of money for donation of eggs.
And then you have
Alright?
pure rotten ones left.
Some vast, some certainly more.
It's true.
Egg.
And whatever is super
Alright? So,
You're supposed to
there are a lot there at the beginning. Okay?
before.
Now, this is a very interesting one. Uterus that we're looking at here. Okay? So, before puberty, all of them are in what phase? The primordial. They're just primordial follicles. Okay? They're just primordial follicles. And once sexual maturity sets in, then now there is a cyclical development over each month. And it said maybe that each ovary will alternatively ovulate. Okay? So, one of my nieces in England, she's very cute. And he was one of the first test tube babies. Yeah, one of the first test tube babies. Right? So father and mother were having problems. So they had to put the things together. So just last time I was looking for a picture, she's a pretty girl and she's one of the first test tube babies in England. Alright, so this now seems to be very interestingly, with this over here, we're not seeing many what? Primordial follicles at all. So the cyclical development will occur, and then when we reach the menopause, then the eggs are run out. Okay? And what happens is that the cortex will now become, the senile cortex will just become fibrous. Okay? Very interesting in here, in that this might have been taken from a rather old person. Because what are we noticing? We are not seeing many what? Primordial follicles at all. Okay, so this is taken from an individual that's quite old. Alright, so now the outermost layer is referred to as what? The germinal epithelium. Okay, but has no germinal function. Where are the little eggs coming from? Ready? Where are the eggs coming from? Yeah, where are the eggs coming from? They're migrating and getting into the ovary, but where are they coming from, ready? The yolk sac. That's asked in the exam all the time. So the eggs are basically coming from where? The yolk sac, the sex cells, primitive sex cells. And they're moving in, isn't that so? And establishing themselves in the ovary. So their original place was in the what? In the yolk sac. So the outermost layer, which is just very simple squamous to maybe cuboidal type epithelium, is known as the what? Germinal epithelium. Deep to the germinal epithelium, what is this layer here known as? The tunica albuginea. Okay? So the tunica albuginea. Alright? So just scouting through here, this is not a very what? This is not a very what? Active looking what? Uterus here. I mean, sorry, ovary. Alright, alright, so let me take up another one right here. Let's look at this guy right here. Alright, let's move on this side. So, we're going to look at a couple of them. So, we'll come back to that one. Wow! So, immediately as I pick up this, I see that what? There are lots of what? Eggs. Lots of ova. Okay, so there are whole lots of ova here. Alright, brother. So as we pick up this, we see there are a lot of ova. So this is from a young person, alright? So very, very, very young here. Alright, so the outermost layer we said is the what? The germinal epithelium. Then just deep to that germinal epithelium. So there's a bit of the germinal epithelium right here. You can actually see some of the cells of the germinal epithelium. And we'll look at some other ovaries and hopefully we'll find a better looking germinal epithelium. But the layer directly below him is known as the what? Tunica albuginea. Alright? And right here, we're beside a Brachlian follicle. Okay, so we're right here beside a Brachlian follicle. And that's the ova that we're looking at right here. And this layer here is known as the what? The zona pellucidum. Alright, the zona pellucidum. Zona pellucidum is right here, and then outside of this is the what? These cells are the cells of the what? These are the granulosa cells, okay? And sometimes this is known as the membrana granulosa, okay? Outside of that, we're going to see now the theca, and there is a what? A theca interna and a theca externa. In the theca interna, the cells are large. Okay? So the theca internal cells are large, and sometimes we see what? Tiny little blood vessels in cross section. Okay? So tiny little vessels in cross section, but that's the theca interna. And then outside of the theca interna are spindle-like cells right near Marlon. So if we go into exam Marlon, right here. Okay? So the theca interna, and right outside of that, we're going to get the theca externa. The theca externa is going to be composed of what? Spindle-like cells. Okay? So immediately we're right on there, and this is known as the what? The antrum. That antrum is going to continue filled with the what? The liquor, follicular liquid. Okay? Now let's go right back out here and start from step 1. Step 1. What are we looking at right here? You know what is that we're looking at right here? Primordial. Why do you say primordial? Why not primary? Why primordial? Why? Go ahead. Why primordial and not primary? Why is that? Okay, so in primordial will have flattened cells. So in the exam, if we go into the exam and the ova is surrounded by flattened cells, then this is a primordial follicle. When they become cuboidal, these become what? Primary. Okay? So these are all primordial follicles right here. So lots of, very good. This is a primary. See the bugger right there? So that's a primary. And lined now by what? Cuboidal cells. Okay? So there we can see the cuboidal cells right here. Okay? So from primordial we go to primary. And when these cells now start to proliferate, these cells are called the what? The granulosa cells. When they start to proliferate, then we'll move into a what? A secondary. Okay? Alright, so we're just seeing here a lot of what? Primordial follicles. Okay? Lots of primordial follicles here. Let's go to local. So this is quite a good slide of the ovary. Okay? That's quite a good slide of the ovary right there. Okay, so lots of primordial follicles right out here. Right here. Let's look at this guy right here. Okay. So we can say that this is going to the region of a secondaries. Okay. So we can see some proliferation here, and we can even see the what? The theca starting to develop, the thecal cells starting to develop around it. Okay. Alright, let's move around this side here. Okay. Whoa. So this is a massive what? Graphian follicle. So this is a fully mature follicle, but what's happened? All the seed is the liquor folliculi, alright, together with the granulosum membrane, granulosum, and the thecal cells. Okay. Now, that's another one, but we can't see the egg in that one. That's the one that we looked at a while ago. So this one is a mature, you could see it's a Graphian follicle, but it's just it's not fully there developed. What is nice to see is when the little stalk is attached. When the little stalk is attached, the whole of that structure is referred to as the what? Cumulus oophorus. Okay, the what? The cumulus oophorus. Okay, so we're not seeing that in any of these. Let's just go through it more and observe. We haven't booked up any corpus luteum or anything like that there yet. No. So these are all just Graphian follicles. Okay? So lots of Graphian follicles. Let's just look at another ovary. Alright, let me go back and look at this ovary here, right here. Okay. Alright. Oh, okay, so if you click on this here. Alright. So once again, this is from a seems an older individual, yeah, because we're not seeing any what? Not many what? Primordial. Okay? So not many primordial at all. Okay? But there is a large what? A massive what? Graphian follicle there. Okay? So maybe in fact this could have just ruptured. I don't know. It looks very close to it. It's actually what? It's just moving towards the what? The germinal epithelium. So maybe just the last couple eggs in this very, 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 very devoid of any primordial follicles or so. Alright? So this is our ovary. Just maybe slightly premenopausal. Okay. Alright, so leave that right there. Let's take up this one. So there are a lot of this one in the exam. I've seen a lot of this guy here. Alright. Okay. So there we are looking down in the medulla. Okay, so that's the medulla right there. The medulla is going to be just continuous at the hilus with the what? The mesovarium. Okay. We're very much out here. So right there, that's the hilus. So that's the hilus right here of the ovary. Or the hilum of the ovary, should we say. And that's the medulla right there. So that's the medulla that comes right and meets the hilum. And these are all the vessels here. What are the name of these vessels? What do you call these? What are the name of these vessels? Really, what are these vessels here? Yeah, anybody have some special names? Anybody knows? What about a man named Zeiss? Using Zeiss optics. What are we talking about? Alright, we'll just leave that for a while there. Okay, so we're coming out here, and in this ovary here, there are just a lot of what? So we see vessels. Okay, so this is just a little atritic follicle here. So this is in the region here. This is just what? Scar tissue. Notice that? That's just scar tissue. So this would be a nice example of a what? A corpus albicans. Okay? In the corpus albicans, all we're going to see is we see very little cells. In the corpus albicans, there are very, very little cells. Albicans, alba means what? White. Okay? Alright, corpus luteum is yellow. Okay? It's white in color. And just a little bit of, it's like scar tissue. Okay? So we're seeing a couple things here. That's a corpus albicans right here. You can see where one might have been earlier on. So once again, this is a this is an ovary of quite an old, but it shows very good right here the hilum and the attachment of the mesovarium. Okay, so that's the mesovarium right here. So all the vessels will be entering and leaving the ovary here.
What time is it?
They're showing you a number then. Let's look at this guy.
11:30. Now I have to go and eat.
Very good. Those are campaniform veins. Those are campaniform veins that we're looking at. Very good. Okay, it's very nice. Very, very, very nice here. So this is another ovary right here. Alright. That's another ovary here. Very good. Alright. And this here now is quite cellular right here. That's quite cellular right there. So that's what? The corpus luteum. Okay? So that's the corpus luteum right there. It's quite cellular. The cells are quite large. The area of the corpus luteum. Sometimes you can find some vessels in it. And in here now it's got sort of breaking down to become the what? The corpus albicans. But notice how cellular these are. Endocrine function, so the cells are quite large, sort of pale staining cells, those fecal cells. I'm going to try to see if I find a better one to show you. Let's look at this guy here now. Okay, so this is a maturing follicle. Notice the antrum is not complete yet, so we don't get a full antrum. The zone of pellucidum is right there, alright, and that's the granulosa cells with the fecal internal and external. This is why I have to go back to that. I think this slide has something else on it of interest. Okay, so there you can see what? So these are the what? These are the fimbrium. Okay, so there's a fimbria. And notice these fimbria are very what? Close to the ovary itself. Alright? That fimbria is very, very, very close to the ovary. Nearly just touching the ovary itself. See it there? So that's the fimbria coming right out. So maybe this is one that they refer to as the fimbria ovarica. The one that will actually touch onto the very close and then now just guide the ovum right into the infundibulum of the uterine tube. Okay? Let's go back to this guy here. I'll go back to this guy for a while. Alright. So once again you can see the granulosa, the fecal cells are right out here. Now these are the cells of the theca interna. And there we can see that it's vascularized. They're not so pale staining in this one. Alright, but you can see the blood vessels, like in the sinusoid in cross section. And that's the liquor folliculi right out here. Okay? Alright. Let's look first at the germinal epithelium. Let's see if this one shows the germinal epithelium. Right here. Yeah, this shows the germinal epithelium now. There's some primordial follicles also. It says if that's the highest resolution on this slide. So that's the germinal epithelium. In this case, looking like to be nearly what? Cuboidal type cells. Yeah, very good. Very good. So that's the germinal epithelium. And just deep to that germinal epithelium now we're seeing the what? The tunica albuginea. And picking up, coming down right here, there are also some primordial follicles. Okay? So what's this one right here? So Zeiss, what is this one here that we're looking at? Is it a primary or primordial? It's a primary. Okay, because lined by what type of epithelium? Cuboidal epithelium. Okay? So that's lined by cuboidal epithelium right here. Okay. So this is the corpus luteum now starting to break down. Alright, so we don't fear here that something breaking down, but you could still identify that as a corpus luteum for sure, because you see the blood vessels in it. It's highly vascularized. The corpus albicans is not vascularized at all. So this is vascularized because it's an endocrine structure. Maybe just that there's some autolysis. And the cells are quite large. These fecal cells are quite large, the lutein cells. Now let's get out here. And that's the tunica albuginea, that's fibrous. Alright, there you can see the fibers there in the tunica albuginea. And coming along here, the germinal epithelium is very, very prominent. You can see if we see some more primordial follicles. So not picking up any here. So leave this slide alone. That's another slide of the ovary. Now let me just pick up another one. Okay, just show you a couple more. Okay. Alright. Wow. So this is not showing much at all. Okay. Alright, so that's a mature follicle right here. Sort of very cellular inside. Outside there what? Primordial guys. Yeah, so those are primordial follicles right over here. This way, lined by what? Squamous epithelium. Okay. The germinal epithelium is quite prominent. Cuboidal cells. And there we see the what? The tunica albuginea just below. Alright. Now to go with the end of here.
Yes.
I'm going to show you next time cervix and vagina. Alright? Because you said you want to leave it early.